All right. Once again, good morning, everyone. This is Bilal Zaka, technical lead in KAISPE. Alongside me is Mr. Adnan Gulzar, which is functional consultant here at KAISPE. Today, we will be demonstrating one of our app based on the Power Platform named Speech TherapyCare. So let me just start with a quick introduction of our company, which is KAISPE. Uh, KSP is one of the leading technology providers in the world, and with the help of Microsoft and Oracle platforms, we make organizations capable of solving complex business problems like monitoring and maintaining business assets in the most cost-effective way possible. And at the same time, keeping their business process agile uh, and make them able to adopt changes quickly. We help our customers to integrate their devices and processes with their sophisticated business applications like CRM, ERPs, using Microsoft Dynamics, Azure, and Power Platform. I also mentioned that our core strengths are related to the Microsoft environment, including Power Platform, business applications, Azure. We have a strong presence in the app source, and we have a 50 plus skillful teams, and we have a dedicated team for sales, marketing, and solution architect as well. We have an experienced and reliable team of engineers and designers who have hands-on experience of implementing business applications and how it can suit any specific business. Focusing our group with strong objectives to deliver quality solutions and to add the value to the customers. Now, as you can see on the screen, these are some of the products which we have created using Microsoft Power Platform environment. You can find them on the app stores as well. Now, beside of all these, we also conduct our trainings in collaboration with Microsoft. Like we have conducted a training for robotic process automation in December alongside with App in a Day. And in the last month of January, we have also conducted a sessions on the Power BI. Now, move towards our today's session, which is on speech therapy. Let's just first check the agenda of today. Our today's agenda is first we will discuss about the healthcare, what is healthcare, how Power Platform is revolutionizing the healthcare industry. Then we will discuss our product, which is speech therapy, and we will discuss some scenarios over there. We will discuss the key features, and then we will discuss the roadmap, saying the future of the healthcare industries. And then you will be allowed to, if to questions. If you have any questions, then you will be allowed. Now, if you, I think all of you have gone through the process that how healthcare is critical in today's world, and the scope of digital health has already created opportunities for physicians to gain an holistic view of their patients' health and for patients to have greater access and ownership of their information. The shopping and interaction habits of, you can say, customers have been changed after pandemic COVID 2019, but unfortunately, the healthcare still seems to lag in technology adoption as compared to other industries. So there's a room for change, and the evolving technologies like cloud computing, automations, sensors, and AI are continuously transforming the operations of physicians, medical clinics, healthcare providers, and nurse line services. Healthcare is still yet to witness better chronic care management, and patient interaction as well. Now, Microsoft Power Platform of, offers a solvent-stop solutions for automation of this decision, and with the help of AI, it makes the healthcare professionals it has provided a healthcare professional the opportunities to create applications in no time and with minimal technical assistance. A research report from Gartner says that almost 70% of the new applications developed by organizations will use low code by 2025. As healthcare providers are now looking for better services delivery operations, the Power Platform adds value while efficiency with using time and money. Now, let's just check some of the benefits of the Power Platform in the healthcare industry. Self-services options have become popular in many industries, though there are many power apps use cases in healthcare, creating self-service portals and clinical applications that helps the patient access their medical records, book appointments and diagnostic and interact with staff and physician as per their needs. Consider a small physician practice. A lot of interaction happens with the staff and patients to book an appointment. In this process, clinics have to withhold doctor's time and the patient wait time also increase. With an automated workflow and applications from Microsoft Power Platform, patients can submit their request from their mobile and then get their service uh, when they need. The volume of the data in healthcare is enormous, and to derive insights from that data is also a challenging thing. With predefined AI and ML models, we can quickly gain insights into the resources and equipment utilization. Now, if you just go through to the dashboarding in our speech therapy app, you can see that we have extracted some of the data based on the diseases that we have treated, the feedbacks on the on the physicians as well. Now, these visualizations will help the patients and attenders to gain insights from there in most efficient way. Now let's just discuss about our speech therapy product. As the healthcare industries has moved toward a more patient-centric approach and active patient engagement throughout the care process, the need for an integrated solutions for speech therapy patient is growing. Patients and their attendants have more interest now to get the medical records, including therapy sessions, recordings, therapist notes, final assessment reports, and other useful documents accessible anytime and anywhere on the cloud. Our speech therapy solution is a fully integrated solution built on top of Microsoft Dynamics 365 Power Platform. The solution provides both an online portal to bring healthcare professionals and patients together and a backend patient relationship management at the backend to maintain records like therapist information, therapy session, patient history, billing payments, etc. The backend applications can be connected to an accounting information system, any e-commerce platform or ERP application through a secure integration mechanism. Our online portal allows patients to access personal health records from anywhere at any time through internet connected devices. Through the speech therapy portal, patients can do online registrations, update their personal information, and complete health forms before visiting the therapist. This not only helps to reduce waiting times for patients, but it also allows staff to spend less time on administrative tasks. Now, let's just see some of the KPIs of our solution. First one is there is a secure password protected access. I think the login feature, which is now common to all of the applications, the registration form, patient can register himself or even attendant or a therapist can also register himself on this portal. Now, if the patient and attendant can view or change their appointments, they can download the recordings of their sessions. Uh, the system can easily integrate it with any of the third-party software. For example, if hospital is using any different kind of software, and we can integrate our speech therapy backend with that hospital with that third-party software. Now, billings and payments can easily be viewed online, and also the attendants or patient can submit the feedback regarding their sessions on any physicians using our speech therapy product. Now we will discuss some of the scenarios, and I will transfer the session to Mr. Adnan to discuss the scenarios there. All right, Adnan, over to you.
So, hello everyone. Greetings for today and welcome to the Speech Therapy Care webinar. My name is Adnan Gulzar and I have been working with the KAISPE for the past 4 years. So, Mr. Bilal has given us a top level overview of the therapy care solution and its impact in the digital world. Now, let's move towards and discuss some use cases of the therapy care solutions. And for today's webinar, due to limited time, we are covering the 3 most essential use cases, which are registration process, where attendant and patient can register themselves. Appointment creation, how they can easily book appointments along with some key user scenarios, and invoice and payment process through the online mechanism. Now, guys, let's talk about it in more detail one by one. So the initial step is the registration process for attendant and patients through the portal. What they need to do is just open the link, and that has already been provided publicly, and then select the register tab. On the registration tab, simply attendant can enter their email address along with the username and password, and in the end, they just hit the register button. Before doing this, let's discuss the other useful options that are visible on the screens. On the right-hand side, we have an option called register using an external account. What does this mean? For suppose, if the attendant already have connected accounts to Azure Active Directory, they can immediately register themselves without filling out any profile-related information, which means he and she doesn't know to add the full name or email address, mobile numbers, etc. Now, the first tab is the sign in button. So if the attendants or patient are already registered, they can easily sign in with their respective user names or email IDs. In case if they forgot their password, they can simply click on the forget your password button. Then an email will be generated and a new password request will be received to your respective attendant email account, which I will show you within a moment. Well, on the right-hand side, we have an option again. It's a sign in with an external account. As I told you earlier, that if the attendant has already Active Directory account, then she registered itself, then they can sign it by using their Azure Active Directory account. Now, on the we have one more option here, which is called the redeem invitation. So the purpose of the redeem invitation is that if therapy companies offer some sort of discounts and promotions to their patient to facilitate them, they can simply add the invitation code here and itself to avail the deals and much more. It may also use in the therapist cases, like where a code would be sent to the relevant therapists and they could quickly register themselves by using the redeem invitations procedure. Now, moving back to the registration process. Now I'm registering as an attendant to explore the portal functionality. So I'm adding some email address and the username along with the passwords. For now, I'm adding as like suppose James at contoso.com. Email ID is James. Password is. And then in the end, just click on the register button. Let's wait for a while. So after adding the professional profile successfully, now what attendant need to do? They first need to update their profile. She then provide the maximum details to the patient for new registration process. So now what I'm doing here, I'm clicking on the profile button and I just add the first name and the last names. For now, James is my first name, Vince is the last name. So you can see that email address auto-populate over here. What I need to do, I just add the email, my phone number, which is suppose this. We can add multiple fields over here, like we can add organization name, the title, the nickname, website, etc. So once you have filled the all optional or mandatory fields, what we do, we just click on the update button. You can see that we have some other options here. You can get the information if you want to know about what's going on, what we are giving some kind of discounts of offers. So you can get the emails by email, the fax, mail, phone, etc. So now what I'm doing, I'm just click on the update button and you can see that my profile has been successfully updated. So what I'm going to do now, I'm going to navigate to the new registration button. Here you can see that the attendant names along with their email address and phone numbers has been populated automatically from the profile section. So After this session, we have to fill up the all mandatory fields like the first name, the last name, date of birth, the concern, the referral, the nationality you have, the concerns you have, and the language of telephone, etc. Also, there are some optional field as well. So it's all depend upon your requirements. If you want to fill up, you can do that. Otherwise, you can leave it for now. So in my case, what I'm doing here, I'm adding the first name is Eva. The last name is Wins. Eva Wins. The date of birth should I selected is I can say that it's 2018 Feb 1st. Gender is female. You have some other optional fields over here, like attending nursery school or others, grade, school names. The other option is here, the relation to the patient. So for now, I'm discussing about my child. So I'm selecting a child below 18. And the relation with my patient is the father, definitely. I'm a father of my children, so I have to add it here. And in the existing physician detail, what we are showing here. Basically, if that patient has previously taken treatment related to any problem or the same concern, you can add the physician detail to the existing field so that therapist is aware of it before taking this first sessions. Now we have other options is the insurance details. So for insurance section, if the person has already insurance policies, whether it's a single or multiple, they can utilize is by selecting from the search insurance search account. For now, we have two insurance companies at the moment, and they both are active. You can see that. For now, I'm selecting the EFU Life Insurance as I have the policy for this particular insurance company. So once we have added this, we have to add maximum data relevant to the insurance companies, which I guess insurance companies will provide it to you. Why we require the insurance details? So as we know that the benefits of the healthcare is very important for us is because health insurance protects you from unexpected high medical costs, peace of mind, and less worry because you know you are covered. It provides financial security by covering the costs related to treatment, and there are a number of advantages of it. For giving maximum data related to the patients, so for now, what I'm doing, I'm adding the emergency name, as it could be David for my case, like David is my emergency person name. I will add the special number, like one, something this. I have to add the nationality is US in my case. My first language is English. We have to add the marital status, professions, and whatever you have the fields are showing here, you can add it. So for a concern, if you know about the concern, you can select from the drop-down list. If you don't know about what is the concern of your patient, you can select the other button and type as per your needs. So for now, I have think that I have a speech issue to my children. So I select it, and now we have the last button is the referral option, so where you can know that how you know about the solutions where we can see that. So for now, we have several option over here. Like it's you are hearing from the Facebook, the social media, from third party, from word to mouth, from Google. So whatever referral you can add it from here. So for now, what I'm doing here, think I search it from the Google, and in the end, we have to click on the submit button. Now, once attendant provide the all information, sorry, so just click on the submit button. Let's wait for a while. So for giving the maximum data related to the patient will decrease the admin effort during the assessment and other related session. So once we have filled up all the fields, what we need to do, the patient attendant record are entered into the backend database at this first step of the new registration process. Now what next? Well, till now, the attendant just provided data related to the patient. Now before request for the therapy, here we can see that the following records have been created after filling up the new registration forms. You can see that we have a search option here. We can have some columns like patient ID, which is populated automatically from the backend database, the patient name, which I set that Eva wins, and the consent, which I select from the drop-down list, is the speech delay, and the primary contact is showing that it's James Winch, which is me basically, and you can see the gender of the patient along with the date of birth. Now, now what we can do that we have to apply for the therapy for this particular patient. So in that case, what we can need to do, we just click on the select the patient and then click on the new therapy request. Now you can that we have another form. So attendant can provide the patient with more information. So during the session, therapists can easily track the all patient information which is required during the first or any kind of sessions. I acknowledge these details are very much, and I do understand that adding the and filling out the form it's a time-consuming process for a human, and I understand. However, the time and administrative work are definitely reduced when the attendant provides as much information about the relevant patient as possible. The therapist can then easily see the all information that belongs to the patient without any hassle and in a one view, which is really helpful without wasting too much time during the process where the patient and attendant visit the signatures, waiting in a queue, then fill out the form and then wait for the appointments. So what we can do, we have to add the maximum data for this particular form. And in the end, we'll just click on the submit button by selecting the terms and conditions. So it's all depend upon the centers. You have to add whatever information on the form, you can do it. If you think the data is too much for the humans, for the normal person, so that you can maximum minimize them. If you think that data is not relevant, you can remove them as well. After that, once we have submitted, now once we have submitted, there are two options over here. So the first option is there that either the therapy center administrator will call the attendant and make the appointment for them, or the attendant can make the appointments on their own for the session. Now here I want to add one more key feature before moving to the apartment use case. As of right now, what we see that we have the new registration form, then see the existing registration form, and then request for the therapy. So we just reserve one therapy, one patient at the moment. What if any firm, some sort of welfare centers, any charity health industries want to register many children for the therapy? So as of right now, our therapy care solutions offer this kind of flexibility, allowing you to include as much as patients as possible under the same center or associations. So what we need to do for this? We just need to create more patients card into the new registration form and submit them gradually. Now, what I need to do, I just click on the new registration button again, add one more patient name here is Denia Vance. So date of birth is like suppose a Fab, gender is female, and I for now I just fill up the all the mandatory fields right now. So in case it's David, I guess I set this phone numbers. You can see that these all fields are showing here. We can customize these all fields as per their needs of your therapy centers. The concern of the Sardinia is, I think, is visual issue she has facing at the moment. Suppose I'm selecting the submit. Now you can see that we have two patients over here. We can add multiple patients by adding from the new registration form. So it could be easy for anyone. So you don't need to add any kind of support from the administrator side, or it's not a big deal for, I think, for everyone. So you can see that without experiencing any kind of delay or needing any kind of assistance from the admin therapy center side, we can add many patient records and request it for the therapy. Now let's move to the appointment section, which is our second use case, and book an appointment for the patients. What we need to do, first of all, we need to create a new appointment by click on the appointment button, then click on the new appointment. Now you can see that we have a new form over here for the appointment. I think it showed me that you know your location, so I said okay, allow. So in patient name, what I'm doing, I'm selecting the patient. Like for my case, we have two patients which I registered right now. First of all, I have selected Eva Vance. You can see the primary email of these GM wins are on the primary contact are showing over here. Once we select the particular patient, we need to add the subject, session fraud screening. So once we have add the subject, now for the therapist field, We have a variety of therapies, and before choosing any one of them, the attendee has to study the therapist's records, like their ratings, their level of expertise, their experience, and much more. So, as a result, they might quickly be satisfied with the therapist descriptions. Like you can see, we have three therapists at the moment. The first one is Adnan Gulzar, which is basically me. Well, I'm not the therapist right now. So we have a title for Adnan Gulzar that he's a certified pathologist, having some kind of 20 years of experience in speech pathologist, having experience in the UK and Australia and some other languages as well. He know well about the certification. So we have two more therapists at the moment, but for now, what I'm doing, I'm just like the therapist Adnan Gulzar. So after selecting the therapists, there's more options like either you want to book an appointment, either could be online or on-site. So what is I mean is that basically this is a key feature of this solution, which gives the user the power to schedule an appointment based on its feasibility. For example, attendant want the online session, which could be on Zoom, it could be on Microsoft Teams, or any kind of medium, which is like Skype. So they can get easily appointment like on their respective email addresses. But for now, I'm selecting the on-site appointment. For the first session, you can see that the session type and session number are populated automatically. After that, what we need to do, we have locations. So we have to select any kind of location which is suits to me. Like you can see that we have option is a nearby location. So attendees can easily set their locations which is suits to them. Like you can see that. So these two locations, which is I think Talha Manzoor south location and Talha Manzoor west location is nearest to me. So definitely I can select select them. But for now, what I'm doing, I'm select the Adnan Gulzar because I think he has a good experience related to the speech therapy. So it's all up to you. This is a leverage of the location which is provided by the therapy care solution. So once you have select the location, what we have to add the date. So in the dates, we have like so you can see that like I'm selecting the Northeast. Yeah, you can see that the highlighted date shows that the therapy is available on these days, like 23, 24, 25 to 28. So these highlighted dates shows that the therapy is available on these dates. So without wasting any time, the attendant can easily select the desired date, and after that, they can also view the time slots. For suppose selecting the 24 date, and you can see that a number of time slots are appear on my screen. So it's all depend upon the attendant or patient. They can select as per their needs and select the suitable slot for their respective appointment. In my case, you can see that we have 10 to 10:30 slots to 9:30, 9, something like that. So once we have selected the screen, the slot, you can see that your appointment date is 24 2 and the time is 10 a.m. Now, when that's the case, what we'll do, we just click on the agree button and then just submit it. Let's wait for a while. Now you can see that how quickly and smoothly we can book an appointment. You can choose the dates and time as per your availability without facing any support from the therapist center side. Now let's discuss one scenario over here. Now, in case if due to any reason, if the attendant want to cancel the appointment, so what they need to do, they just select the appropriate appointment and just click on the cancel button without any kind of delay. So in the meantime, what will be happen? The admin center, the therapist will get also notified about the cancellation of this particular appointment, and you will get also an email on your respective email address. So this is the appointment use cases. Now discuss our third case, which is invoicing and payment. So guys, as we know that we have to pay the certain amounts, you can also say that fees for the therapists before and after the session. It could be vary to company to therapy centers. So we already catered the automated process for the invoicing. How? Simply, we integrate with the appointment sections. Like once you attend and book an appointment, invoice for the relevant session has been generated automatically and appears on the invoice sections on the portal. Like you can see that on the invoice sections. Yes, you can see that. The invoice has been populated automatically along with there's some columns like invoice ID, name, which is the subject which I set on the appointment section, the patient name, appointment, and the total amounts. If there is some kind of discount or tax, then these amounts value will also appear on this invoice screen. Now, what we need to do for invoice payment, we just select the appropriate invoice and you can click on the process to pay button. Now you can see that invoice just screens appeared. So the person can select the invoice and then pay the amount. So we have two options over here. Payment method. The first one is the PayPal, Google, and PayPal and the Google. So we can it's all depend upon the attender where which want to pay. In my case, what I'm doing, I'm click by using the PayPal account and pay the amount for this particular apartment. Now, before paying the amount, let's discuss one more scenario over here. Like suppose if you have multiple invoice concept, how you can pay the amount for multiple invoices. For suppose if the attendants have multiple kids for checkup or in any association center want to pay the amount at a time for multiple invoices, so they can easily select the invoice records and pay it simply. Like I'm creating and book an appointment for like suppose I'm booking appointment for my second patient, which is Denia Vince. Adding the subject, session for therapy, like the therapies, which is the Adnan user, could be the on-site, location is Northeast. You can see the highlighted areas are appeared here. So if I select the 24th February, you can see that there's the slot for the 10 a.m., which I select for the my first patient has been disappeared. So this is the beauty of the solutions we have. Now we have other options like we can select the 10:30 a.m. and choose it. And just click on the terms and condition and submit it. Let's wait for a while. Now you can see that we have two apartments on the apartment screens. The first one is Eva, the second apartment is for the Denia. So we have two invoices now, I guess. So let's see how it works. Go to the invoice sections. For now, we have the single invoice. I think it will be appeared within a few minutes. Let's wait for a while. Till now, we are paying the invoice for the Eva invoice, like the PayPal payment option. So $990 complete purchase. Like you can see that transaction has been completed successfully. So once transaction has been completed successfully, it will be moved to the paid invoices. So the current invoice is showing for the Denia, and for the EVA invoice has been showing on the paid invoices where you can see that it's paid automatically. Like if I want to pay for the Denia, what we need to do is just select the Denia invoice and pay as well. So you can see that transaction has been completed successfully, and now invoices has been appeared on the invoice screen. So though both invoices will be appeared on the paid invoices sections, let's see how it works. Like you can see that the both invoices has been paid from the online digital portals by using the PayPal payment method. So now you may understand how the procedure operates without affecting the admin center support, and how the entire therapy care cycle has been digitally automated. One additional thing I want to highlight in that is this therapy care solution is not just for the speech therapy care. Any sector of healthcare can use it. For instance, if a patient want a general physician or a doctor to do a normal checkup for any type of disease, he or she can easily schedule an appointment, pay for the doctor fees, and connect with the appropriate doctor for a particular issue, whether it could be online or on site. The medical records history is also maintaining, and attendant can easily track them by using the portal. So where they can track them, the all records for the medical, they just go to the medical records. So during the therapy sessions, whatever assessment sessions, the screening session, or the therapy session, the all data records. It could be the prescriptions, it could be the video recording, it could be anything. So during the sessions will be appeared over here. And the end, we have got a discharge option here. So guys, this is all from my side. We have covered all three cases, which is related to the therapy care center. So now let's move to Mr. Bilal.
Thank you, Adnan, to discuss all of the scenarios in too much details and also to discuss the other possibilities of the integration of this therapy care product. Now, let me just discuss some of the roadmaps in which you can say the future of the healthcare and the functionalities which are on our roadmap and which we were trying to implement on for our speech therapy care product. Now, all of you must have about the chat GPT thing. We are trying to integrate the chat GPT on our product to guide the patients for their appointment booking of for their booking process. Also to guide them about the disorders thing in details so they get the insights before actually the therapy session will start. Now, the telemedicine thing, I hope you all have heard about telemedicine, which in which the patients and doctors can have a video or phone call appointments between them, and they get the benefits uh, and they get the benefit and convenience for both of them. Now, if for long distance patients and physicians, it will be a helpful tool. Also, the prediction models will have a prominent role in the healthcare and research and practice. Diagnostic and prediction models make the prediction about the current health status of a patient, also can estimate the probability of the health outcome in the future. Now, this was all about the you can say today's session. Now, if we have some time, then if we have some time for you, you guys can ask the questions, and also if you have the feedback regarding our product, you can email us as well. Mr. Adnan will show you the email address and
So actually we have some kind of timer at the moment, right? So let me share you one more thing, which is very useful. Logging from my another account, which is Scout. So we are discussing about the medical records. So as you can see that for these particular Scott Adams, he have some existing registration, which is the Henry Adams, Mary Adams, Sean Adams. So they all are the existing registration patients for this particular primary context. We already booked the appointments for the respective patients, and you can see there are records for this relevant patient name. You can see that for the initial screening, they both have been completed their status, their sessions, which is the first sessions. For the initial screenings, date will be on 10th. So what in this session? So during the session, the patient, the therapist address the all known issues, which is related to the patient, which is Henry, I think. So you can see that initial screening findings and the therapist their notes. If they want to add the notes, the therapist lessons number, the date of the sessions, along if they want to add any kind of an attachment, it could be possible. You can also print out the report as well. Now, once the screening session has been completed, the therapist assume that he or she patient need to do some kind of assessment session. So, like suppose in Henry case, we have conduct therapist conduct assessment session and it's completed as well. So in the therapy sessions, what therapists do, therapists do some kind of research relevant to their speech delay issues, swallowing kind of pathology issues, and you can see there are some number of fields showing over here. That referral observation is good, social development history is average, and some kind of assessment hearing speech issue, delay issues, some language evaluation issues, and you can see that you can add the goals for your next therapy sessions. So what I'm saying, want to say that therapy sessions have been single or multiple. So if therapists think about that, the sessions should be one to more two, then they can suggest the more sessions. It could be there for the assessment, it could be for the therapy session. So it's all depend upon the therapist suggestions. So it quite be flexible in our system that you can add multiple sessions for the same therapy for the relevant patient. Also, we have set up over here, like you can see that in the message tab, the all relevant message which is sent already to their respective attendant will appear over here. Like you can see that we have some kind of messages in the message section that Genesis reports always sent for the Maddie Adams, for Henry. User has been created once it created. So this is all our kind of functionality are already available in the patient portal sections. Also, we have a leverage, like suppose if a therapy center is not working on like public holidays, it's not working on a weekend, so we give a pop-up on the screen and we can set the slots for the therapists to avoid any kind of like public dates. These date, what we can do, we just remove the roster from the therapist for on these dates. So this is all rosters for the therapist can be quite flexible. It can be more customizable. So it's all depend upon your needs of the therapy care center. We can do that. So this is all from my side. So if you guys have any queries and questions, then please feel free to ask. So guys, thank you for participating in today's webinar. In case of any query and question, please feel free to email us at info@caspi.com. We do love to hear from you guys. And thank you so much, everyone, from my side and from the Blazaka side. So hope you to see you soon in any upcoming webinars. So have a good day, guys.